Hello, today is Tuesday, December 29th. I am joined again by Dr. Janae Caldoon, our Chief Medical Executive here. I hope everyone was able to have a little time over the holidays to relax and acknowledge what a year this has been that is coming to a close. Since my last press briefing, our numbers have continued to improve. We've always taken a fact-based approach to eradicating this virus, and we have been looking at measurements like falling cases, percentage of COVID hospital beds that are available, and falling positive test rates. And now, because of the actions that we've taken, and because so many Michiganders have done their part, our numbers are better than all of our Midwestern neighbors. These numbers are encouraging. We will continue to monitor them closely to see if holiday travel will have a significant impact. And so I'm asking that everyone continue to do what you have been doing. Stay home for New Year's, maybe get some takeout, support your local restaurants and local businesses, but stay close to home and celebrate responsibly. We are coming through the end of 2020 in a stronger position than most. It's because of you. So as we work to distribute the safe and effective vaccines that are now on the market, it is more important than ever that we continue to do the safety protocols we know work. That's mask wearing, that's social distancing, that's washing our hands. Even if you're one of the people that has gotten the vaccine or are in line to get it soon, it's really important to keep doing that till most people have been able to do that as well. Which is why, once again, I'm urging our Michigan legislature to pass some public health protections. Passing legislation that would require masks in public. This is a policy that has bipartisan support that would really improve compliance and assist law enforcement and help stop the spread of COVID-19 so that we can re-engage more sectors of our economy and stay safe. Studies have shown that if we all wear masks until the vaccine is widely distributed, we will save hundreds of thousands of lives in the United States, and certainly a great deal more, many more lives here in Michigan. Studies have shown that these actions work. Yesterday, my administration announced that we have begun distributing these safe and vaccines to skilled nursing home residents and staff. Now, these residents are among the first facilities to receive the vaccine through our Pharmacy Partnership for Long-Term Care, our LTC program. The Pharmacy Partnership is a national initiative to provide COVID-19 vaccines to Phase 1A groups of long-term care facility residents and staff. MDHHS is partnering with CVS and Walgreens through the program to manage and facilitate safe vaccinations while reducing the burden on our long-term care facilities and local health departments. We know this virus is a killer that preys on our most vulnerable populations, which is why my administration has prioritized testing in our nursing homes from the very beginning. Now we have developed a plan that prioritizes residents and staff. Remember, it will take some time for this vaccine to be widely distributed to everyone, and that's why it's important that we continue to all do our part. One of the most important things that Michigan adults can do right now is to make your plan to get one of these vaccines. They are safe and effective, and when it becomes available to you, we want to make sure that you're ready to get your vaccine. To provide more information about the vaccine, DHHS has developed a COVID-19 vaccine provider guidance and educational resources that are available on the DHHS website. The page will include facts, FAQs, information about both Pfizer and Moderna vaccines, and information for providers. And should additional vaccines become approved and available, they will be included as well. I encourage everyone to make your plan for you and your family. And until then, I urge you to continue doing your part to stay safe, to protect your family and our frontline workers alike, and our small business owners, of course. Today, this morning, before this press conference, I signed a bipartisan supplemental budget that includes $106 million in relief to protect families, frontline workers, and small businesses. I proposed the My COVID Relief Plan to the legislature back in November because I know how much our families, our frontline workers, and our small businesses need relief as we are getting through this tough winter. The bipartisan relief bill will provide families and small businesses the support they need to stay afloat as we continue working to distribute these vaccines and eradicate COVID-19 once and for all. The bill includes $55 million to help small businesses impacted by COVID-19. Grants of up to $20,000 are going to be made available to small businesses across Michigan that need some support this winter. And the relief bill also includes $3.5 million for grants of up to $40,000 each for live music and entertainment venues. So it includes $45 million in addition as direct payments to workers who have been laid off or furloughed as a result of this virus. So this is a positive step, but there is still much more work to do to eliminate the virus and to grow our economy. On Sunday, the President signed a COVID relief bill that provides some support for Michigan's unemployed workers. Once again, I want to urge the federal government to pass a bill that includes $2,000 in stimulus checks for American families. It's the right thing to do. The bill that the President signed extends benefits to self-employed and gig workers and provides all unemployment recipients an additional $300 per week. The extension will bring much-needed relief to 700,000 Michigan workers who are currently receiving benefits under the federal UI programs. The continuation of these benefits with the additional $300 a week for all claimants will give our workers the emergency financial assistance to buy essential items like groceries or prescription drugs. Michigan, like every state in the nation, must wait until guidance is issued by the U.S. Department of Labor before we can begin processing the benefits provided under the new legislation. And so we're hopeful that will happen quickly. Rest assured that the UIA is making program adjustments with whatever information becomes available, and we will work tirelessly to implement any remaining changes as soon as it can in order to get benefits out the door as quickly as possible. Again, it's another positive thing, but there is much work left to do at the state level to protect our unemployed workers. And that's why today I also signed a bipartisan bill by Senator Hertel to extend unemployment benefits from 20 to 26 weeks through March. This is the right thing to do, and it'll help Michiganders across the state who've lost work as a result of the pandemic. When I signed the supplemental budget, I had to line item veto any items that were not subject to our negotiated agreement with the legislature. That includes $220 million giveaway of taxpayer money to the employer-owned Unemployment Insurance Trust Fund. Be very clear, this will not impact individual workers. General fund dollars have got to be used to fund essential services like vaccines and PPE, not to give tax breaks to big businesses right now. The Unemployment Insurance Agency has also provided more than $900 million to help businesses that have been impacted by COVID. So we have helped, but this went too far because it is really important we use every precious general fund dollar we can to help get through the current crisis. So the funding that I vetoed has nothing to do with extending benefits. It's a line item veto that will not prevent any unemployed Michigander from getting their benefits. I want to be very clear about that. We have done everything focused around helping those who are unemployed throughout this crisis, and we will continue to do so as my administration. I signed the extension of the bill because the legislature really needs to come back and finish the job. Making this extension not just temporary, but permanent, increasing the weekly benefit, and providing much-needed support for Michiganders who've lost work is what I hope the legislature will focus on when they come back to work January 13th. We've got to work together to pass a bipartisan permanent extension to protect countless Michiganders and their livelihoods. The extension of benefits to hardworking Michiganders should not be used as any sort of a bargaining chip or tied to other priorities that the legislature might have outside of protecting public health and our economy. We need to take bipartisan action now. Thousands of Michiganders' benefits are on the line. So let's work together and make this extension permanent. 2020 is coming to an end this week, but our work is not done. I want to remind all of you that this pandemic will not be over just with the beginning of a new year. But with the new year comes renewed hope and reasons for optimism. I really believe 2021, after talking to all of our experts, after building out what we can do here as a state, after having regular conversations with the incoming administration in DC, I really believe every year of 2021 is going to get better than the last. We can make sure that that's the case if we all do our part and work together. All Michiganders have a role to play. Masking up, practicing safe social distancing, supporting our small businesses throughout this crisis, and avoiding indoor gatherings that spread the virus. These are ways every one of us can do our part. So let's all work together to eradicate this virus once and for all and make 2021 a great year, a year where we can come together at the end of it and celebrate like we normally would. Thank you for doing your part. And with that, I'll hand it over to Dr. Khaldun.
Good morning, and thank you, Governor. So as a state, we are now at 480,508 cases and 12,089 deaths due to COVID-19. As the Governor mentioned, we are cautiously optimistic about the data we are seeing in the state. So here's where we are with the three main metrics that we are tracking. Cases are now at 279 cases per million people and have been declining for more than 38 days. We are still at a rate that is almost 4 times what we saw at the beginning of September. Test positivity is now at 8.4% and has been declining for multiple weeks. This rate is almost 3 times where we were at the beginning of September. 2 areas of the state, the Saginaw and Jackson regions, have test positivity above 10%. And while those regions have also seen declines in cases, they also still have the highest case rate in the state. 13.8% of inpatient beds in the state are being used to treat people with COVID-19, and that is down from 16.5% the previous week. The number of deaths that we are seeing is also coming down. In the most recent week, there was an average of 107 deaths per day compared to 123 deaths per day the previous week. So overall, there is reason to be cautiously optimistic, but it's important that people do not get complacent. What we are seeing in the data is not a cause to celebrate. While Michiganders are doing a great job bringing our cases down, that progress is fragile. We are still identifying many cases across this state every day, and it only takes one gathering for it to spread through multiple households and their close contacts. So while we are certainly moving in the right direction, let's all do our part and remain vigilant. Wear your mask anytime you'll be around someone outside of your household. Try creative ways to ring in the new year with virtual calls with family and friends. Let's just get through the rest of this holiday season and give ourselves the strongest start to 2021 without a surge in cases from the holidays. So part of each person's responsibility in ending this pandemic is also getting tested. Testing is actually lower than it has been in recent months, at 37,307 tests on average in the past week. If you need a test, you should get one. This means that if you have symptoms, or if you've been around someone who has symptoms or around someone who has COVID-19, you should get a test. There are over 300 testing sites across the state, and many of them are free. So please go to our website, michigan.gov/coronavirus test, to find a location that's nearest you. This testing is so important and the only way we're going to know where this disease is so that we can stop it from spreading. So as the governor mentioned, 2 weeks ago, we started vaccinations in Michigan to end this pandemic. And today, we will be reporting that nearly 71,000 people have already been vaccinated in Michigan. Yesterday, we also started vaccinating in our long-term care facilities across the state. There are already over 490 clinics scheduled in these facilities in the upcoming weeks. This is historic. I'm so proud of the hospitals, the local health departments, pharmacies, doctors, nurses, and others across the state that are working so hard to get people vaccinated. Every area of the state will have access to the vaccine, whether you're in a rural part of the Upper Peninsula or in the Detroit or Grand Rapids metro regions. I was grateful to be vaccinated a couple of weeks ago with other frontline healthcare workers, and the process was very simple. My arm was sore for about a day after I got the vaccine, and I'm looking forward to next week when I will make sure to keep my appointment and get my second booster shot of the vaccine to make sure that I am fully protected. Now, I know that there are some people who have questions about the vaccines, and it's okay. It's actually a good thing to have questions. But I also want people to know where to go for answers. Michigan has a website, michigan.gov/COVID vaccine, where you can find information on how many vaccines have been distributed across the state, how many people have been vaccinated, and the ages of those who have been vaccinated. We also have important information about the vaccines themselves. These vaccines are safe and have been evaluated by the top scientists in the country. They've been studied in tens of thousands of people. There's a robust national monitoring system, more than exists for most medications, in fact. Any adverse reactions are immediately reported and tracked across the entire country. Now, I know there have been reports of some people having allergic reactions to the vaccine. And as an ER doctor, I take any reaction to a vaccine seriously. And it's important that the vaccine manufacturers continue to evaluate any allergic reactions so they can find out the cause and prevent as many of them from happening as possible. But I also want people to know that current reports across the country indicate that people who have had severe allergic reactions to the Pfizer or Moderna vaccine have also had severe allergic reactions to other medications in the past, and that there are still very few reports of allergic reactions to the vaccines compared to the over 2 million people across the country who have already gotten the vaccine so far. So if you do not have a history of a severe allergic reaction to the components of the vaccine, then you should still get vaccinated. And you should talk to your doctor about any concerns you may have about your medication allergies. Like other tools that we use in medicine and public health to keep people alive and healthy, these vaccines are an important tool to end this pandemic and save lives. The stakes are just too high for us not to take this opportunity to save ourselves. And this is particularly important in communities of color that have been hit especially hard by this pandemic. While it will be several months before we have enough vaccine to be able to vaccinate everyone who wants one, this is the way that we will end this pandemic. And if we can keep our cases low while vaccinating as many people as possible, we will beat this virus. So please be planning now for how you will get the vaccine when it becomes available to you. I also know that the holidays may be emotionally difficult for some people. The loss that many people have experienced this year has been devastating. Let's please remember to check in on loved ones, friends, and family throughout the rest of this holiday season with a phone call or a virtual check-in. And if you or someone you know may be struggling with their mental health, please know that we have resources available. You can go to our website, michigan.gov/staywell. It's okay not to feel happy at this time of year, and it's okay for you to seek out help if you need it. Please take care of both your physical and mental health and check in on loved ones who may be having a hard time at this time of year. So overall, I am optimistic. The end of this pandemic is near. Vaccines are being distributed across the state, and our case numbers are coming down. We know that masks work, and many people across the state are wearing them. And we know that Michiganders have what it takes to bring this curve down and keep it down. 2021 is going to be a much better year, so please, everyone, continue to be careful and do your part so we can bring this pandemic to an end. And with that, I'll turn it back over to Governor Whitmer.
Thank you, Dr. J. All right, with that, happy to open it up for a few questions.
Governor, the first question will come from Tim Skubic.
Thank you, Governor. Governor, can you give us a timeline on when we might reach the 70 to 80% of the population in Michigan being inoculated? And in that period of moving up to that number, do you expect the caseloads and the death count to come down correspondingly?
Tim, I am going to ask Dr. J to come to the microphone, and she can give you some insight on to all those questions.
Yeah, so I think everyone across the country wants these vaccines to be administered to people as quickly as possible. And if we get more vaccine, we will be getting it into people's arms as quickly as we can. But we are limited right now, like every other state, by how much we have allocated. But you're absolutely right. As we start getting vaccines out and distributed across the state, we know those vaccines are 90 to 95% effective. So we do expect our case numbers and especially our deaths to come down, especially as we're vaccinating some of our most vulnerable, like people who are living in our long-term care facilities.
Okay, the next question will come from Lindsay with Wood TV.
Thanks for taking my question. On the vaccine front, I'm wondering if you've identified factors contributing to the large gap that we're seeing between what the state has distributed and what's been administered. And if you are seeing some factors, what are they? I'm also wondering if you have a response to some questions we've been receiving from viewers in West Michigan who say they know of people who may work for a hospital system, but they are not involved with direct care, and they are receiving their first dose before those who are actually treating patients. And what would the message be to the hospital systems who may have that approach?
So I'll have to defer, especially on the latter part of your question, to Dr. J. I will just start with this. I think throughout this crisis, it's been really helpful for me to have some perspective by staying in regular contact with my fellow governors. And what we are seeing with regard to some of the initial struggles across the country is that every state in the nation is dealing with building up an apparatus to get vaccines disseminated as quickly as possible, but with a federal government that still doesn't have a reliable regular administration and plan for getting vaccines to the states. And so our experience is not unique here in Michigan, and we are working at all hours of the day to make sure that we are building upon what we do get from the federal government so that we're able to move swiftly and get more vaccines made available to people as they become available. But we, as a nation, are all struggling with this. And so we in Michigan, I believe, have got a good plan. We're going to continue to be nimble and improve where there are opportunities to. But this certainly is an issue that stems from a lot of the lack of planning on the federal government's part that we're trying to make up for here as we build out our apparatus. With regard to some of the conversation about what's happening in our hospitals and how that's working, I'm going to ask Dr. J to answer that and certainly invite her to add anything she wants to the first question that I answered.
Yeah, there's no question this is the most massive vaccination effort that we've ever undertaken in this country. And I think that it's the operational challenges of it means that it is, I think, moving slower than any of us actually wants it to. I've talked to a lot of hospital leaders. I'm speaking to chief medical officers of hospitals across the state tomorrow to understand what some of their operational challenges may be. I do know, quite frankly, that some of them intentionally wanted to start just a little bit slow just to make sure they knew the process and how to move people through as quickly as possible. I will say we do expect it to increase as far as the speed of vaccines being administered to people. We are also expanding our support as far as human resource support so that everyone can move as quickly as they can and that staffing is not a challenge. To the other question about healthcare workers within that priority 1A group potentially getting vaccinated before others, while we certainly agree with the ACIP priority guidance and we want there to be equitable distribution of vaccines, it is most important that we get these vaccines out and administered as quickly as possible. A vaccine that is administered to someone who's a healthcare worker is not a wasted vaccine. And so, again, we are working with our hospitals. It is certainly not a perfect system, but I'm actually glad that someone got that vaccine and it's not sitting in a freezer. So we will continue to work with our hospitals to administer the vaccine across every provider who's in that phase 1A group as quickly as possible.
Great. The next question will come from Kim Russell with TV7.
Hi, Governor. With the case numbers decreasing, what do you think people should expect when it comes to restrictions being eased? What data points are you looking for? Are we watching hospital levels? Are there still concerns there? Are there certain things in the projections that you're concerned about because of Christmas gatherings?
Yeah, so I mean, I think it's the same kind of data points that we have been looking at, right? So it's the percent of positivity in our cases. It is hospitalizations. We're also looking at things like mobility data. We know that for Thanksgiving, a lot of Michiganders took it very seriously, and we're not out and about, we're not gathering, and we saw that that worked to all of our benefit because our numbers have been on a continuous decline. As Dr. J said, they're still 4 times where they were back in September, and so they're still high, but they have been moving in the right direction. And if that continues to be the case, then certainly we would feel that there was lower risk in terms of re-engaging other sectors of our economy. We have a modeling call tonight, as we do every Tuesday. Dr. J and I were just talking about we haven't seen the mobility data, but that is a helpful to our understanding and anticipation of what we may see in terms of the numbers 10 days out from the holiday. So these are all part of the conversation that we're having with our experts as they are giving us advice about what next steps are wise to take so we can re-engage.
Hey, Governor, we'll go to Beth with the Detroit News.
Thanks, Governor. I guess for businesses struggling to pay unemployment or, struggling with other financial issues, I guess, do you feel that the state's aid to them has been enough that they don't need this extra $220 million?
So, Beth, the $220 million was a deposit into a fund. It doesn't immediately go to the needs of anybody right now, which is a big part of the problem. I've been working to expand access to unemployment benefits. I worked against the last administration that changed it from 26 weeks to 20 weeks. Through executive orders earlier in this year, I extended those. We've been working with the legislature to try to get them to do a permanent extension. So much of the work that we have done has been about helping the unemployed and help businesses who are struggling because of the pandemic. what happened in that supplemental doesn't have anything to do with solving the public health crisis and helping people who are struggling right now. And that's why it was not a wise use of precious little general fund money that we need to build out our apparatus for vaccine administration. It was not negotiated, it was thrown in there, and it was disappointing, and that's why I've had to take the action that I have. It does not jeopardize a single effort or resource that is dedicated toward helping our unemployed. And anyone who tells you that just isn't being honest about what that really was all about.
All right, we've got time for just a few more questions, so we'll go to Dave with the Detroit Free Press.
Hi, Governor. Can you provide some sort of timeline on when businesses or employees who are eligible for the grants in this bill might start applying for and ultimately receiving those funds?
Dave, we will follow up with you to give you a little more concrete information as to what that looks like. We're moving very quickly. We have built up an apparatus at the state level. I think the question about the federal funds with the delay in the president not signing it, it will cost Michiganders who are unemployed a week's worth of resources that they desperately need. It was really heartbreaking to see the president stall on that. While I was pleased that he eventually signed it, that's good. I'm hopeful that Congress moves forward on the 2,000 that he says he supports. Because this is really crucial. At the state level, the resources that we have available, we're moving quickly, but in terms of those federal dollars, this delay caused by the president's, travel or what, I don't really know why they delayed so long, is going to cost Michiganders a week, and so it's a real problem, but at least it was done in the end. So we will follow up with you in terms of additional information about what those specific dates look like when we have greater detail from the feds.
All right, Governor, we'll close with the last question coming from Eric Lloyd with TV 9 and 10.
Hello, Governor. I was wondering, Lindsay had most of my question, but I also wanted to ask, is it up to the hospitals and health departments to hold back some of the vaccine for those second doses, or is that just coming from the new shipments every week?
I think it's important that you hear from our chief medical executive, so I want to make sure that she's got an opportunity to answer that. Before I turn it over, since this is the last question, I want to wish everyone a happy new year. I ask that you continue to double down. You've been doing a great job when you see how Michigan compares to the rest of the country. We want to keep moving forward. We all continue to do our part. We're in a stronger position to do that. And I just say this, I know that Dr. J had the Pfizer vaccine. Dr. J had the Pfizer vaccine. I know that Vice President-elect Kamala Harris had the Moderna vaccine today. As I talked with the CEO of Moderna, he acknowledged that some of doctors with whom he's got relationships have been asking, which one should I get? The CEO of Moderna said it doesn't matter. If you have access and ability to take a Pfizer vaccine or a Moderna vaccine, whatever is available, do it because of the high efficacy and safety of both these vaccines. So I just wanted to reiterate that because I think it's important that people know these have incredible efficacy, much higher than even the flu shot that we all take for granted and many of us get every year. And they are safe. And so just wanted to reiterate that. With regard to your specific question, I'll ask Dr. J to address it.
Thank you. So the way the program and the allocations work at the federal level, the federal government has already held back those second doses of vaccine, and so hospitals who administered those first vaccines a couple of weeks ago, they're already placing orders so that those second doses can be shipped and they can start those next week. So the federal government is holding back those second doses for us. Thank you, everyone. Have a happy new year.
All right. Thank you.